Hey guys, it's Yayuna with part 2 of my OSH tour. So come along with me as we view things and get some handkerchiefs ready, and let's look at this. It's something. It really is. So these are restraints, cuff restraints, leather restraints with which people were held down. Right here, 2 a.m., Mrs. Bernard would not remain in bed. She was restrained with a jacket and a belt in 1913. Something like this. Lord forgive us. Handcuffs. We've come so far and we still have far to go, but Lord, this is why it's illegal, restraint and seclusion. Can you imagine being in a bed like this? So without going into a lot of detail, you guys know I work with people with disabilities, and some of the people I work with did come out of the institution, and one of them, one of the individuals, has PTSD due to the fact that they saw someone very close to them there at the institution also die. They were both restrained to their beds, and this person watched the other person die due to lack of care. So, even to this day, we have some of these individuals who came out of these places who are still dealing with the memories of this stuff. I'm going to record all of this because I don't know if any of you are going to be able to come here, but, let us not forget. Let us always remember, learn where you came from so you don't have to repeat history, Weights. Harold's Pharmacy, magnesium oxide, aspirin inlay. So this video is going to be long. I'm not really going to edit a lot out. This is something that's very near and dear to me. I'm not a perfect staff. I still have a long way to go. I've been doing this type of work for over 20 years, but I have so much to learn still. And this is something I really feel people need to know. So thanks for joining me. So eventually, part of treatment is art therapy now, to help people, just express themselves. Let's move. We're in a different area now, so we'll start looking around here. Okay, so this press was used to print the patient newsletter, first called the Tarrytown Tatler and then the Lamplighter. So it's a printing press. Sewing machine. Matron's report, work done by patients during the biennium in the sewing room. So this is all the work that was done. And here's a photo of them all working. Sewing machine. And right here, it's talking about a world below. The buildings are connected by 1.87 miles of tunnels under Center Street, and the tunnel therapy probe was due. Dank depths is what it's talking about. So right here it says that patients were known to conduct liaisons along the underground tunnels. Some wards are co-ed, and this is what it looked like before. And there's a loom on top, but here you go. So that's what, and this is how the laundry was moved back and forth between buildings. So information on the alcoholic brain. This is from Ward 4 surgery, economy tourniquet, clinical electroencephalography. So this is like what it would look like, and studying on what they were looking for. And this is what it would have looked like. Most of the buildings are torn down and redone. Just this area remains. So they have pictures and stuff of what it looked like back then. Look at the old radiator about training at OSH, Oregon State Hospital. And they have information on all the different things they did. Psychiatric training, rotated on a 6-month unit system according to their needs and previous experience. And here you guys can pause it and read it. And here through the 60s and 70s, due to a variety of factors, they started to experience difficulties. And again, I'll go slow and you can pause it and read. Psychodiagnostics, the Rorschach test, Wechsler intelligence scale, and those are still kind of in use now. Birth at the hospital, oh my gosh. Fully functioning hospital. This bassinet in here were used at the hospital. Surgical department, deliveries at OSH. This was for amputations, appendectomies, births. Oh my gosh. This is what it looked like at first. Oh my gosh. They had youth programs. Here's some more art. I know, guys, this is long, and it will be long, and I'm not apologizing for it. This is important to me, so. Turkey wing fan used for ceremonies, sweat lodge and smudge ceremonies. A Torah. A Bible. I don't know what kind of Bible this is. It's in German. Meditations of Native American elders. For communion. It's a communion set, so they had religion and spirituality here, how they dealt with it. Dean Brooks' room. We are here to serve the patient. Dr. Dean Brooks.
To tell us things that were happening there that he thought.
And he was in the movie, and I think he's the one that was showing he actually was working here, so he didn't know what was going to be said during the movie. So the reactions you see when you watch One Flew Over the Cuckoo's Nest, that really was him being himself.
The entire legislature to allocate funds for the building of not only a new hospital, but also a final resting place for the cremains that were discovered.
No words really describe what it's like when you first see them, as we did, the condition.
Okay, you guys, so I'm here in this room, which is kind of like a media room, and it's going over the story about the cremains and canisters that are still here, and how even to this day, families are still finding out about family members that were here, and some people are choosing to allow to leave the remains, the cremated remains of their family members here, or they're taking them. But it's talking about the canisters, and I took pictures and I kind of recorded it a little closer, but you see right the other way, right there, that's a canister, that's a remain of someone who died here and was cremated because their families did not claim them. And it used to be like, I guess there's this huge room where there's still remains there, and out about 100 yards from here, there's a spot which we will walk to, and we'll go definitely pay our respects. But yeah, and find fact, not fault. Dean Brooks. So
in
Over
2004.
3,000 individuals
so
died
they
here
kind of trickled out.
and were
through those
never claimed
stories,
by their
and we got
families.
a lot of reaction from that.